Gabatril, also known as tiagabine, is used with other medications to treat certain types of seizures, specifically focal seizures. It works by reducing the spread of seizure activity in the brain. This medication is classified as an anticonvulsant or antiepileptic drug. When using Gabatril for conditions other than epilepsy, serious reactions, including seizures in people who have never had them, have occurred. It is important to talk to your doctor for more details and to determine the best time to take this medication. Before taking Gabatril, it's important to read the medication guide provided by your pharmacist and ask your doctor or pharmacist if you have any questions. Take Gabatril by mouth with food as directed by your doctor. Your doctor may start you on a low dose and gradually increase it to reduce the risk of side effects. During the first week of treatment, you'll usually take it once a day, and then your doctor may increase your dose to 2 to 4 times daily in the following weeks. Gabatril is not usually used by itself, so do not stop your other anti-seizure medication unless your doctor tells you to do so. The dosage is based on your medical condition, response to treatment, and other medications you may be taking, so be sure to tell your doctor and pharmacist about all the products you use. Take Gabatril regularly at the same times each day to get the most benefit from it. Do not stop taking this medication without consulting your doctor, as some conditions, such as seizures, may become worse when the drug is suddenly stopped. If you stop taking Gabatril for several days, talk with your doctor about how to restart it, as you may need to restart with a low dose and slowly increase your dose again. Remember to tell your doctor if your seizures get worse. Some common side effects of Gabatril include dizziness, drowsiness, stomach pain, diarrhea, nervousness, tiredness, or shaking. However, many people using this medication do not have serious side effects. It's important to tell your doctor if you experience weakness, trouble concentrating, trouble speaking, confusion, or any unusual changes in your mood, thoughts, or behavior. In rare cases, a serious allergic reaction may occur, so seek medical help if you notice symptoms such as rash, itching, swelling, severe dizziness, or trouble breathing. If you have a seizure that doesn't stop, seek medical help right away. And remember, this is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. As always, consult your healthcare provider for personalized guidance. Before taking Gabatril, it's important to inform your doctor or pharmacist if you have any allergies. This medication may contain inactive ingredients that can cause allergic reactions or other issues. Before using Gabatril, make sure to discuss your medical history with your doctor or pharmacist, especially if you have liver disease, mental/mood disorders, or seizures that don't stop. Gabatril may cause dizziness or drowsiness. Avoid alcohol or marijuana as they can increase these effects. It's important not to drive or use machinery until you can do so safely. Limit alcoholic beverages and talk to your doctor if you are using marijuana. Before undergoing surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of Gabatril, especially dizziness or confusion, which can increase the risk of falling. If you are pregnant, Gabatril should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. It is unknown if Gabatril passes into breast milk, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Gabatril, as they can affect how the medication works and may increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. This includes prescription and non-prescription drugs, as well as herbal products. One product that may interact with Gabatril is Orlistat. Additionally, it's important to inform your doctor or pharmacist if you are taking other products that cause drowsiness, such as alcohol, marijuana, antihistamines, drugs for sleep or anxiety, muscle relaxants, and opioid pain relievers. Also, be sure to check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. If you have any concerns, it's best to ask your pharmacist about using these products safely. If someone has taken too much Gabatril and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can call their provincial poison control center. Symptoms of an overdose may include severe drowsiness, uncontrolled seizures, slow or shallow breathing, and loss of consciousness. It's important not to share Gabitril with others, as it is prescribed specifically for your condition. Your healthcare provider may also perform lab or medical tests, such as checking your blood levels, while you are taking this medication. Be sure to keep all of your medical and lab appointments as scheduled. If you forget to take a dose of Gabitril, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed dose and take the next one at your regular time. Do not take a double dose to make up for the missed one. If you happen to miss taking Gabitril for several days, it's important to get in touch with your doctor for instructions. Make sure to store Gabitril at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from the reach of children and pets. When it comes to disposing of Gabitril, don't flush it down the toilet or pour it into a drain unless you're specifically instructed to do so. Instead, make sure to properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to dispose of Gabitril. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.